Hi, my name is Tabitha. I'm going to be talking today about microbiology case study for one of my college classes. I'm currently work at our hospital in a laboratory. I'm a laboratory manager and microbiology supervisor. And so let's get started on microbiology case studies. The patient is a 61-year-old male presenting to the ER with high fever, body aches, shortness of breath, and cough. There was labs were ordered: CBC, CMP, D-dimer, lactate, and 2 sets of blood cultures, as well as a chest X-ray. The patient had only medical history they had was of having diabetes. Actually, they had a previous history of having COVID 7 days prior to being admitted to the ER. And the only semblance of anything that their past history, they were a local farmer, worked with horses, was a horse trainer. Our first thoughts when you look at this patient's symptoms that they are presenting with: possible complications from COVID, possible pneumonia, possible blood clots. Labs were done on this patient. A CBC, abnormals. They had a white count of 17.04, with a normal range being 4.7 to 10.8, so it's elevated. They 87% neutrophils, 4.2% lymphocytes, 7.5% monocytes, 0.2% basophils, 0.0% eosinophils, and 0.7% immature granules, which probably based on that was probably bands. There was a D-dimer performed. It was 2,910 with a normal range of being 0 to 500. Lactate came back elevated, as well as a D-dimer and the white count of CBC. Lactate was 8.2, the normal range 0.7 to 2.1. Glucose was 582, which goes right along with this patient's history of being diabetic. There was 2 sets of blood cultures drawn, and they were flagged positive and subbed to anaerobically and aerobically to media within 24 hours. What was discovered from all this on the cultures? There was growth on the chocolate and blood agar, but no growth on the McConkey plate. There was growth anaerobically, but it was subbed to the media to CO2. And then there was CO2, there was growth in the CO2, which shows it was not an anaerobe. We do hold our anaerobe plates for 5 days, so there was no change in that. We gram stained it. It was gram-positive cocci and chains. Catalase negative. We set up an A disc, seen as it was beta hemolytic on the blood agar. The A disc was negative. And then, since we don't have another serology kit to determine what group of strep this is, obviously we know it's not A, we set up on the ID on our Vitek 2 compact. The ID that we got was Streptococcus equi subspecies zooepidemicus, which is a gram-positive cocci and chains. It is beta hemolytic on the blood agar plate and looks very similar to group A strep or strep pyogenes. But the next question is, how was this patient exposed? How was he septic? How did he catch this if he had COVID? First of all, the patient had COVID, and therefore he was immunocompromised because he had diabetes, underlying illness of diabetes. The patient raised horses and was currently treating an open wound on one of his horse's legs. It's not unknown how he became septic due to he had no open wounds himself. The treatment: this patient was placed on blood thinners, of course, for a possible blood clot since he had a elevated D-dimer. The patient's glucose was monitored as well due to him being diabetic. The patient was treated with antibiotics. I'm not exactly sure what antibiotics he was given. It was up to the physician. There were 2 sets of blood cultures drawn after the antibiotics had been administered. They were negative this time. So now let's talk a little bit about this bacteria, Streptococcus equi subspecies zooepidemicus. It is an opportunistic pathogen. It's found in the mucous membranes of horses, so it's normal flora to the horses. It is a gram-positive cocci, beta hemolytic, it actually belongs to group C Streptococcus family. It can cause pneumonia, meningitis, and septicemia in humans as well as animal species. It does grow in blood and chocolate. The recommended antibiotic treatment for this is penicillin G or cephalosporins. So the conclusion to this case, this amazing case, anyone that's immunocompromised can become infected with bacteria that's classified as normal flora in humans or animals. Thank you.